So we mentioned COVID, and now we're on to our continuing coverage of the coronavirus pandemic. New concerns about dangerous reactions to the vaccines. And to help us break this down and understand all of it, we're going to bring in our friend and medical expert, Dr. Arnold Baskies. He's the past chairman of the National Board of Directors of the American Cancer Society and also chair of the Global Cancer Control Advisory Council. Dr. B, awesome to see you.
Good morning, Stephanie.
So I've been dying to talk to you about this because it's really put a lot of people off about the J&J vaccine. We learned that it's aware of at least 4 cases where people develop blood clots after taking that J&J vaccine. And while the AstraZeneca vaccine is not being administered in the U.S., their drug is also being linked to some rare cases of blood clots in Europe. So help us understand, what does this mean?
So, as you mentioned, the road got a little bumpy for 2 vaccine candidates, AstraZeneca's vaccine and J&J's vaccine. This week, the European Medicines Agency concluded that the Astra vaccine is possibly linked to a very, very rare occurrence of blood clots, especially among women 55 or older, and 20 countries have now paused the rollout of the Astra vaccine. I should also point out that this occurrence is exceedingly rare, and a lot more information is needed before we can draw any firm conclusions. As for J&J, there have been 3 reported cases of similar blood clots occurring in 5 million doses that have been given in the United States. The FDA is aware of the blood clot potential issue and has not found any causal relationship with the vaccine. There's no clear causal relationship between these rare events and the COVID-19 J&J vaccine. We need more information before we can make any conclusions. J&J has also run into some other issues with production with their vaccine. And as you mentioned earlier, the allocation of doses around the country is going to be down by about 86% in the coming week or 2. Here's the issue, though. 20 million doses have been given of the Astra vaccine in England and in Europe, and 27 million doses in India. It's the vaccine that's planned to be given to 2.5 billion people around the world. And Astra plans to make 3 billion doses of their vaccine available by the end of the year around the world. So this problem has to be addressed. It's very important.
But, you know, locally, a lot of people are concerned about the Johnson Johnson vaccine. I could say myself, I was covering a story this past week in Germantown where they held a clinic for people who specifically, it was for people who were nervous about getting the vaccine. And they heard about the Johnson Johnson vaccine, and a lot of them, some of them walked away from getting that vaccine. So what would you tell those people if they're nervous?
Well, a couple of things. One is that there has been some fainting spells that have been associated with the J&J vaccine, but we don't know if it's directly related to that or it's just the fear of getting the vaccine that caused that. As for the clotting issue, it's a very, very rare occurrence, and so we really need more information as to whether or not it represents a real and present issue for patients who are going to get it. For now, it remains a question, and that's the best we can say.
So, all right, put that aside for a moment. We know that the drug companies developed the COVID vaccines in record time, so let's talk about another moonshot. There's already talk in the scientific community about a pill that would actually help the body fight off COVID. So I know this is maybe a long way away. How would this work, and what is the likelihood of that ever becoming a realistic medical option?
So actually, it's not a long way away. It's another one of these things that science has been precipitated by the current pandemic that we're in. It's a high priority, and several labs are working on this. What the world really needs is a pill like Tamiflu that we have for the flu, but for COVID. Ideally, it should have a low price tag. It should be taken orally and have very few side effects. So far, as you know, the only medicine that we really have to combat COVID is remdesivir, which is given intravenously. So there are 3 candidates to create a pill against COVID that I know of. Merck is about to announce very shortly that they have data on an oral treatment similar to remdesivir. It's a repurposed drug that was originally used for hepatitis. So Merck has a drug that they're going to be giving us data on very, very shortly, a pill. Then there's Pfizer, which has engineered a drug specifically for COVID, and they have already started their clinical trials with this pill in March. And for purposes of full disclosure, I'm on the board of a company called Anixa, which has discovered 2 compounds which are active against COVID in the lab. We will begin very shortly the next stage of development in animal testing. So the hope is that very soon we will have a simple pill to treat COVID like we do for the flu with Tamiflu. So it isn't a pipe dream. It's a reality, and it's going to be coming very soon.
All right. Well, thank you for correcting me on that, because it might happen maybe by the time we start to talk about getting our booster shots. All right. Dr. B, thank you.
Anytime, Stephanie.